Go.
This is Dr. Charles Stevens, a physical therapist and the owner of Mobile Therapy Services here in Dallas. We are the only EMG and nerve conduction study in Dallas, and we're making a little video here to talk about nerve conduction studies with a diagnosis of carpal tunnel syndrome. Sometimes patients have a little bit of anxiety about this test before they come, so this is an informative video just to kind of lessens people's individuals' anxiety and also their worries about this test. So we have anesthesia here. Carpal tunnel syndrome involves the median nerve at the wrist. A lot of times patients are going to complain of tingling, burning, and numbness in the first 3 digits and half of the fourth. Sometimes this can refer symptoms up into the forearm or into the upper arm. This test is going to look for slowing of that nerve at the wrist. We're directing a little tiny stimulus of electricity down the nerve, and as anesthesia, my sister, who is our volunteer, is going to feel a little tiny tingle come right down into that 3rd digit. So anesthesia, open up the hand just a little bit, great. Hold it there. And if our videographer can zoom in on the screen, we're sending a little tiny stimulus down into the hand. We're recording how long it takes that nerve to travel 14 centimeters into the hand. We can also come in and stimulate that nerve at the palm. And ideally it would take less than 3.7 milliseconds to travel 14 centimeters from the wrist to the 3rd digit. Anastasia's hand is a little bit cold, so we're getting some slowing there. That's not true slowing. Ultimately, if we were doing a real test, that we would warm her hand up a little bit preceding this test. So that goes to show you the importance of limb warming preceding a nerve conduction study or EMG. People with carpal tunnel syndrome often will complain of difficulty with fine motor control, their hand falling asleep at night, driving. So this test can give us an answer on where the symptoms are coming from. Also, those symptoms in the hand could be coming from the elbow or also up into the neck or the brachial plexus, which is a network of nerves up around the collarbone. So this test can help us better treat individuals in physical therapy and give them an answer on where their symptoms are coming from so we can give them the best care. If this test will benefit you or anybody you know, please give our office a call at 570-282-9382. EMG and nerve conduction studies are all covered by all major medical insurances, and insurance companies recognize doctors of physical therapy as able to perform and interpret those studies.